One suture.
Previously on Birth Stories.
You know what? I'll be honest with you. I'm going to get Dr. Windrum to come and do the rest.
What do you think that was? She said it looked different.
It looked different to me than what I've seen normally.
Okay. There you go. Christmas Pearl.
There. Merry Christmas.
Christmas Pearl.
So that if it's 4 in the morning and you wake up and you're contracting and Trevor says, oh my gosh, what did Tracy say about when to call in labor? You have a cheat sheet.
A midwife reviews the signs of labor. It's that difficult last stretch of pregnancy for Cassie. She and Trevor have been living together for 4 years, since Cassie was 16. Soon, they'll be parents.
Good. 125 over 85. That's great. So your blood pressure continues to be at the upper end of normal, which is fine and reasonable, but it makes me want to encourage you to do lots of resting and just take it really easy.
Maybe I'm just got this hope that it'll come earlier than the 19th.
I know. Lots of women do.
Yeah.
I mean, how can you not, right? You're really excited to meet the person.
Yeah.
Tracy is a nurse who delivers babies for a living. But the most recent delivery she attended was her own. Little Mackenzie is just 2 days old. Her obstetrician, also her co-worker, checks in.
Hello.
Tracy, how are you?
Not too bad. How are you?
So, she looks lovely.
Yeah.
So, can you believe it yet, or?
I was just looking at her and looking at her fingers and her toes, and then I wanted her to sleep. No more crying.
Yeah, any problems with the stitches or anything at all?
No, actually, they were fine.
And the feeding is going okay?
They're going fine. What I would find is she's feeding all the time, so I didn't know if it was me or if something was going on. My milk wasn't coming in, but she was like really, and she has a really good suck, so.
So hopefully it'll swing in over the weekend. All right.
Thank you.
I'll say goodbye.
I appreciate it.
Take care. Thanks a lot.
You gonna say bye? Say bye.
Give you food instead.
So they checked the heart rate, made sure I wasn't having any contractions yet. And the good news is I'm not, because I'm not ready. That's for sure.
Not ready yet, because there's a lot to do. Donna is mother to 2 young children. She's also stepmom to 2 more. For this third baby, she's been imagining an ambitious home birth, a party for the whole family.
Well, what I'm thinking is that when I do go into labor, I want to labor here. You know, obviously, I'll be in my home. I want to have friends and family around. I just want to enjoy the moment. The last 2, I was induced. It was so different. It was like a very sterile thing. Like I had to go into the hospital, book a room, get hooked up to an IV. And I'm just hoping that if I go into labor naturally, it will just happen gradually and I can just be really cool about it. And then I'm, hoping that, I'll have people here and, my husband and a few other people along with my midwives will be upstairs with me and that I'll be able to just give birth in my bed and, have a great time. Bring the baby down and show everybody. I don't know how they do that. But I've never had a baby at home before, so it'd be really exciting to do that.
High in a condo on the downtown waterfront, Ken decorates the nursery for the baby he and Katie never thought they'd have.
You ready to see this? It's not quite right, but better take a look at it now, that way I can faint over it.
Whoa, I love it. It's great. It's excellent. I like it. So how are you going to put the frogs up?
Only a year ago, 2 months before their wedding, Katie was diagnosed with cervical cancer and facing, at best, a hysterectomy. But instead, a rare and radical surgery removed her cervix, but saved her uterus. Soon after, Katie was pregnant.
Say something like that. That's
Yeah,
pretty cool.
it's going to look really good. I think it's much better than having it up the top. Good job.
It's because, the head is low, and it hurts. I can't when I roll over in bed, it wakes me up. Anytime I roll over, or when I try and get out of bed to even go to the bathroom, it's like, ah! And then I get to the bathroom, and then I go to sit back down, and even that feels like a chore. I just can't believe, like, the pain hasn't subsided, or I haven't got used to it or anything. Like, if this is it now, like, what is, like, birth gonna be like? I'm gonna wuss out or something. I don't know.
We've been doing some like practice massaging, and because
It was really nice because my back was hurting.
But she was saying, you know, like my feet are hurting so bad. You know, like I said, well, do you want me to put some cream and massage? And she's like, there's no point in doing that because it'll be gone and I'll be still in pain after a couple of minutes. I said, okay, well.
That's exactly what I said. I said, it's not
okay.
gonna do anything, and I fell right to sleep.
Yeah.
That was really nice.
And then I was telling her, how's this? Okay, I guess it's good. Yeah.
I'm thinking it'll go quicker too because it's the third, and because I've been doing this for 4 years now, I'm thinking my body's like ready to just like pop this one out. That's what I'm hoping for anyway. So that's it. Here he comes. It kills me when he does that. Hang on. I know, let me just see. That's my mother. Hi.
Donna's confidence in her birth plan comes with an effort. Her husband is keen, but other family members prefer the conventional route.
Okay. All right then. Bye. We made the mistake of mentioning home birth, and she's panicked about that. She's very concerned. My mother's very old school. We're Italian. Not that that means anything, except that she's just very, very involved. We're very close. There you go. Is that good? That's what you wanted.
They said the baby's fine and everything else is fine. They're just more worried about me being sick because of my high blood pressure. And this is Trevor's sister, Laura.
Hello. Hi, Laura. Hi.
High blood pressure has put Cassie in the hospital, and as a precaution, her labor will be induced.
We're just gonna put your head down. Okay.
So come right over, and then shuffle your hips.
Oh, is this the tightening I'm supposed to feel?
Yeah, that's like a contraction.
Well, it usually doesn't work quite that quickly, but
Well, it kind of hurts.
what are you feeling? Does it feel like
It feels really crummy. It doesn't feel very nice.
Does it feel like a menstrual cramp?
Yeah, it feels like my period's gonna come.
So right now we're winning the battle with the blood pressure at the moment.
Oh wow, I haven't seen it like that in a while.
No. Right now it looks okay. You take more of a risk driving here to the hospital than you do actually having something bad happen during an epidural.
If you could explain to me what an epidural feels like, then maybe I would consider it, but...
We give you an injection of local anesthetic, just a tiny little needle like that into
Right.
your back, and that part burns. It's like being stung by a bee.
Okay.
That's the freezing. And after that, you really shouldn't feel much in terms of pain.
So is it like one of these going in a little bit, or...
Similar, only a lot of people actually say that the IV is worse.
Really?
So you did great with the IV, so.
Thank you very much. You're very nice and informative.
nice.
Yeah.
Our wedding anniversary is coming up.
Yeah.
Trick question.
6th of January. I
6th
remember.
of January. So, given that, so it's not even a year yet. And look at all the exciting things. I promised you adventure and excitement.
These days, Katie has to take it easy. Without a cervix, a single stitch holds her uterus closed and her baby safe inside. The chance of premature labor is high, and Katie and Ken have learned to take things a day at a time.
Just that word, when you hear cancer, you think, God, I'm gonna die. And that's kind of weird. It made me pretty sad, because I thought that maybe I wouldn't be able to have kids. The funny thing was, I guess, that I had complete faith in all the doctors that I dealt with. Like, I never once doubted that they couldn't cure the problem. Once I'd got to the point where I'd found a doctor who could perform the surgery and so on, I never really thought it's not an option. that I'm not going to get better. So.
Pretty soon I'll be able to braid her hair.
Back home, Tracy and Mark introduce baby Mackenzie to her new digs.
Daddy's putting on your sock.
Man, she can water ski with these things. Holy
Marky.
They're so long.
Daddy's making fun of you.
Yeah. Look at that.
Say, I'm spitting image reviews, Daddy, so you can make fun of me all you want.
So. Huh?
Huh? Oh, sing a song to your group.
It's my last one. I wanted to do something different, and I'm glad. I'm glad I've had this experience. When I had Rock, I thought that was my last one, and I remember saying, you know, I'm always going to regret I didn't try midwife, so now I don't have to regret it. Yeah, what did I measure?
32.5.
That's not bad.
Which is still a little bit, you know, below your number of weeks, but that's sort of the way this baby has been growing, so.
Yeah. Just a little anxious again about whether or not I'll go into labor on my own, seeing that I've never been able to do that in the past, but you know, I'm hoping I can do it this time.
Yeah.
Can I pull this off like completely on my own?
If you're not feeling comfortable, then you need to tell us that, and we can alter the plans and go from there.
Yeah. I'm very, very close to my family. We're all very tight-knit, and they all, you know, believe in, you know, like the doctor thing and the, you know, the hospital thing, and for them, my mother, it just hit her the other day. She said to me, well, who's your doctor? And I said, no, I don't have doctors. I've told you I have midwives this time. And you should have seen the look on her face. Well, because she's also picturing her mother who had babies with midwives. And she started with, well, my mother lost 6 babies at home because, you know, she had them at home and not in the hospital. And that's all I need to hear. And if everything's great, well, let's go for it. And if it's not, then I want, you know, then I want to feel, you know, very confident and free to say, let's move on. And I know that you'll be fine with that.
We'll certainly be there to support your choice, and if your choice is to go into the hospital, then we certainly can.
The epidural's not what I thought it was. Like I said, my tattoos hurt worse. So I did good.
I think without the epidural, it would have.
It probably would have been a whole different story. So.
I don't even think you would have got any sleep. Like, I don't think so.
Wouldn't. Hours have passed. It's early morning on the birthday of Cassie and Trevor's baby.
Are you okay?
Yeah.
Okay.
Just a little pressure.
Little pressure? Okay. Feel like you have to push?
We don't want you to start pushing too early or you get tired. Okay, did you get some sleep? Good.
So it'll still take you a little bit, probably an hour.
Yep.
But if you're rested up and you have good pain relief, it should help. Okay? All right.
So, congratulations, your third baby.
As her due date approaches, Donna still has some inner conflict over a home birth, and she reaches out for help from a birthing hypnotherapist.
As much as I'm very interested and excited about having a home birth, I still have doubts about it, to be honest. I still have a few concerns, and you know, and I'm thinking, well, why not? If everything's going fine, I should be able to do this, and that'll be, I think, a remarkable thing to have done. And it will feel like an accomplishment, and also to have been able to do it without an epidural this time. That would be exciting for me.
It's hard. It's just, you know, we want the best for our babies, and what is the best? You know, on one hand, we're getting this cultural message that home birth is not appropriate. On the other hand, you read the research and it says it's quite fine. So what do you do?
That's the thing. And I've got, you know, a family who, you know, I'm very tight with, who, you know, keeps, they add to it. They add, you know, putting the doubts into my mind and all that. And I mean, and it plays on me. And I try not to. I try to be my own person and to just think, no, this is what I want to do, and I know that this is right and this will be fine. But it's just, you know, and it's also thinking, oh man, if anything was to happen, and not because I can't deal with
we told you so, but but still, that would just be, then it's just going to be harder for me. It'd be torture for me later on.
Would it be helpful to get you kind of connected with this baby and ask the baby what the baby wants? I mean, some babies have very clear ideas about where they want to be born. And so it can be reassuring to kind of connect with your baby when you're in the trance state.
Really push. Good girl. Change your breath out, take it out, bring it in quickly, use your momentum, make it your second one. Strong. Bring it down. Hard. That's a little bit different. Good for you. Bring it in again.
I'm just gonna see if the baby moves with this one. Harden your bum. Harden your bum. Right here. Right here. Excellent job.
Good girl.
Right
there
there.
you go.
Excellent job. Good. You're pushing in the right direction.
Good, so you can relax in between.
And let your legs just
Go.
So to take a moment and make sure that tube of light from your heart to your baby's heart and from your baby's heart to your heart is open. And surround your baby with love. And to bring your baby's soul into your awareness. Does your baby have a preference about where to be born? Does your baby feel safe being born at home? The hypnotherapist has given Donna hand signals for responses while under hypnosis. Donna's signal means the baby is unsure. Is that partly from your feelings about having a home birth? Your baby feeling unsafe about that. Is that partly your feelings? Yes, and so in some part of you, you're holding on to an awareness that it's not safe to have your baby at home.
Ready? And then longer. Keep it longer. Hips wide. Hips. That's it. Good for you. Strong. Oh, that was good. Okay, last push. Last push right to there. As strong as you can. Harder than that. Come on, keep it down. That's it. Push that baby down. Push it down. Strong. Little farther. Oh, here it comes. That's great. You're lovely, darling.
Oh, look at him.
Okay, Trevor, you want to put a hand there? It's going to get a one.
Oh, it's hard coming over. Yeah, but you need it. It hurts. He's so small.
He's not small. He's perfect.
Perfect size for you.
Okay. And then lift him up. And I want you to just lift up your shirt. He sounds great. Can I switch for the warm towel? You just hold him like that. Take this one off.
Look at his feet. He's got huge feet.
Is he going to be a tall guy? I'd like to keep his head a little bit warm there.
Yeah.
I just would like to be the physical assessment, but I'll do the Okay?
It's okay.
Sorry.
That was beautiful.
Very nice delivery. You did a great job, Cassie. Looks pretty good to me.
Okay.
Gorgeous. Yeah.
7'1". He's 7 pounds.
So can you tell?
Well, I can tell that it's holding.
Katie has regular ultrasounds to keep an eye on her stitch and any unusual changes in tissue. But recently, there's been one more thing to worry about. Something new has caught the eye of medical staff. An abnormality in one of the unborn baby's kidneys. Katie and Ken won't know whether it's serious until the baby is born.
The biggest downer, I guess, was you're sort of coming into a special pregnancy clinic to look at one thing. You're looking at the stitch, and you watch that, and that's all going really well, and then all of a sudden, out of nowhere, you start seeing things that are abnormal, and I guess it was a bit of a downer when I first saw it. I burst into tears. So
yeah, she called me at work, and
it's just something you don't want to see. You don't want to see something bad happen to your baby. Like, the main thing is just to have the baby and make sure everything else is okay with the baby.
they wouldn't actually operate.
And
you know
then,
what I mean? Yeah.
After a week or so after the birth, we can sort of reassess it, look at it, see what's happened because the baby doesn't actually use its kidneys while it's inside you. It's using my kidneys.
You know, it might be.
It's just a matter of keeping it all in perspective, I think. That's the main thing. And the main thing is just to have a healthy baby and, you know, one kidney.
Hello, Leah. Go see your mommy now? Yeah. You got some burnings on you because you were on the early side. There you go. There's your mommy.
Look at him.
Doesn't he look like you?
Hey, buddy.
He looks just like Cassie.
He does.
I know.
Oh. He's beautiful. He's beautiful.
Hi, buddy.
He looks like Patrick. Looks like Gordy.
How do you feel?
Really good. I can't believe, like, yesterday he was kicking my stomach. Today he's here. I'm so shocked.
Are the antenatals in here?
Against the background of baby becoming a big boy.
Next time on Birth Stories.
And everything. I wonder if we shouldn't change your section date.
Sure.
So, okay, so get organized, we'll see you over to talk.
Okay.
Trevor's been like really like awesome help too. Like just tells me to sit and relax, relax.
Everything is good. I can't find nothing bad. No matter how tired you are or whatever, when he wakes you up, you just, you know, you're okay.